Welcome to Chapter 6 for Exercise Leadership 2. We'll go over 6.1 today and 6.2 tomorrow. All right, building rapport. Again, they've talked about building rapport, building rapport, building rapport. Now they're kind of giving you a little bit more insight into how to do that. One, be empathetic, right? Try to experience another person's world as if it were your own, right? And again, sometimes you can put yourself in some people's shoes, sometimes you can't, but I mean, you can at least be, if you can't be empathetic, be sympathetic. But yeah, do your best, right? And just at least try to understand who they are and where they're coming from and why they are where they are, right? Again, be warm to them, right? Again, I don't know why you wouldn't be. You're trying to get them as a client. I don't know why you'd be cold to somebody that you're trying to get as a client. So I don't even know why that's on there. And just be genuine. Don't be a used car salesman, right? It's not what it's about. It's about just being genuine and just being open and honest with how you can help them and understand what they're going through. All right. So there's different things, cognitive and effectual messages. So cognitive messages are, like you're just stating the facts. Effective are composed of feelings, emotions, and behaviors. I unfortunately am not good at effective. I actually have to be really mindful to do that. Cognitive is just my wheelhouse. That's where I live. Again, I try to work on the second part and I try to engage people in conversations about the second part. But when I impart knowledge on people, I stay in the cognitive. I guess that's just how I work, how my mind works. Most important thing you can do is listen, right? Problem is a lot of people will turn into indifferent listening halfway through the conversation, because as soon as they hear, they're like, oh yeah, I want to lose weight. You start thinking about what you're going to do rather than listen to the whole story, right? Or selective listening. Person listens to only keywords. This sort of reminds me of what you see in television and the media, where they take snippets of like people's conversations and they try to say, oh, this is what you said. Whereas if you ever watch the whole recording of something, you're like, no, that's not what they were saying, which tends to be the common thing that the media likes to do now so that they can influence the way we think and feel about people. Passive listening, a person gives the impression of listening by using minimal committal agreements, like nodding your head and going, uh-huh, uh-huh, uh-huh. And then there's active listening. You're showing empathy, you're listening, you're asking questions in between, like not interrupting them, but like, wait, so they did this and what did you do? Those things, like you're listening, right? And it's obvious you're listening. Okay. Again, other things that will help you better help them. Ask additional questions to get more information. Again, know when you're like getting too personal or asking too much, like don't be one of those people that doesn't realize like you're diving into deep waters. But yeah, get as much of the whole picture as you can, right? Clarify questions. So if like you're okay, so are you meaning like you want this, or are you meaning like you want that, right? So again, like one of the things, somebody will come and they're like, I want to be toned. Okay, so are you wanting to like be toned and be like skinny toned, or do you want to be like muscular toned, right? Because again, toned isn't a it's not a fitness classification for, it's people say it, but it doesn't mean anything. But again, when somebody says toned, there's a couple things that they mean by that, right? So you clarify. Informing, expand upon shared information with facts. And again, don't just throw stuff out there. It needs to be relevant to what they've said. And then questioning, directing both open-ended and closed-ended questions to a client, right? So, like get some yes or no's when you need to, but open-end is always good because you get a better picture of what they want. Again, communication style. So this is a tough thing because they're saying that you need to have a style that matches the client's needs and personality. This is where sometimes I feel, like if you have a certain way that you are, you're not going to really mix with everybody. And again, this is where I would disagree with where they're going with this, is that like you should be able to help every person that walks in your door. One, that's untrue. That's not going to happen. I mean, no matter what, even if you like really get along with somebody, like some folks are just, they're not quite at that point where they can really make a lifestyle change, no matter how good you are. Okay. Two, this is where I offer the alternative that, like if you feel like your time with them is going to be a struggle for you, if you feel like their time with you possibly could be a struggle for them to be with you, it's not a good fit, and that's not a bad thing, right? We don't have to be a personal trainer to everybody, and this is why it's important, especially if you're working at a place where there's multiple trainers, that it's okay. And if your personality is not really built for them, or their personality is not really built to where you want to be working with them, every day or whatever it is, um, if you know somebody that works at the gym that's a trainer that you're like, I think they'd actually really get along, it's okay to point them in that direction. It honestly is, and it's important to understand that. Um, there's, I mean, I know it like, you think, okay, I'm losing out on money or whatever else, but if you can establish those relationships with other trainers, there's going to be people they're going to point in your direction. I'm going to keep saying that because if we can help people, which is what we're supposed to be doing, and if you can, if you can do the right thing, yeah, like boomerang effect, you throw stuff out there, it'll come back to you, right? So again, it's important to do that. Okay. Now, when you have somebody, you need to be able to educate them in a way that they can understand and it gets the point across. And so again, one of the things I've learned just being coaching over the years and teaching over the years, is that you may have a certain way that you like to do things, and teach, and if you notice someone's getting lost, you can switch it up, like be like, all right, let's try it this way, and you just keep going until they finally get it, like, let me explain it this way, let me explain it this way. Yeah, I like to use a lot of stories in the way I teach. I like to give a lot of examples. You know, that's just how I do things. Sometimes that doesn't work for some folks, and I have to switch it up. Um, Again, when you're counseling somebody, you need to be supportive. Sometimes, um, they have this next part over here, directing styles more instructive. Sometimes just being supportive, like with the right person, and you have the right rapport with them and everything. Sometimes it's holding them accountable, right? Not just being like, oh, it's okay. Like sometimes you gotta be like, look, bro, we've had this conversation too many times. You gotta fix this, right? Sometimes you gotta be that way, right? And you gotta help them solve their problems. Um, and then sometimes you just gotta be very instructive in what you do, right? How you want it done, where you want it done, so on and so forth, right? Um, Again, asking people, here's some good questions like, all right, give me your typical rundown of your week, right? Like what physical things do you do during the day? If you do anything, right? Sometimes I don't. Um, what is your work like? What is your day like? Your business day or your house day or what are, those type of things. What do you like to do when you're not at work, right? If, when's the last time you've gone and done like, something physical, like, being outdoors, like going walking, biking, hiking, surfing, um, once you develop rapport, with them, then you can, they're going to be more open with you. And again, if they're coming in to talk to you, here's the thing: you already know that they're in a stage of change of like they're in the contemplation prep stage. I mean, one of those two. Contemplation at worst, prep at best, right? Um, so we already know they're there. They can't be in pre-contemplation. If they were, they wouldn't even know who you are and what you're doing, and they wouldn't be in there inquiring information from you. All right. Motivational interviewing. To be honest, this is one of those things that you should get really, really good at. And you got to get so good at it that you don't know that you're doing it. And what this is, because they really do kind of a poor job of explaining what motivational interviewing is. You're not really determining their level of readiness. That's trans theoretical model. Again, yes, you're going to educate them on reasons for change. But again, they've got to ask the questions, and you've got to, provide that. And really, what it boils down to with this is, if they're ready to change, they've got to basically come to that conclusion, right? You're kind of, you can look at it this way: you're guiding them towards that, towards that decision, but they're the ones that actually have to arrive at that decision and make that decision, not you. Okay, that's what motivational interviewing is. You're just helping, field questions and guide them in the right direction. Readiness to change questionnaire, honestly, waste of time. You don't really need this. You just got to have a good conversation with somebody, and figure out where they're at, right? Um, so again, health risk appraisal. You have to do these, and you have to screen them for things, because if they answer yes to any of the questions that are on there for cardiovascular stuff, a doctor's got to sign off on what they do. You should never work with somebody that is not either, they go through the health risk appraisal, so as far as they know, they're healthy, or um, or they're being dishonest with you, one of the two, but you don't know that. But if they answer yes to any of those things, you got to send them to a doc, and the doc's going to either give them, like, not necessarily a clean bill of health, so to speak, but a clean bill of health to work out, or they're going to give them a workout, like, they're allowed to work out, minus they can't do this, right? This is what you got to work around. Okay. um and so it is what it is, and you'll have to work around that. Even if you feel the doctor's being ridiculous, you're like, they should be able to do that. It's not worth you crossing that line. So don't think even if you are smarter than their doctor, please don't act like it and do something stupid, because for legal reasons, if something happened, like say they got hurt doing that thing, say they have heart issues, right? But while they're doing the squats, they end up tearing their ACL. It has nothing to do with their heart. But then they come back at you, and the thing is on that piece of paper it said, don't let them do squats. You're screwed. I mean, it just don't do that. Okay. I know there's, like, I've talked to a lot of trainers, and they're like, yeah, but no, it's not worth it. And I was giving you best case scenario. They didn't have a heart attack. What if they did have a heart attack? It's not worth it. You can do so many other things besides squats. And again, I love squats, but I'm just saying, right? um so the screening will look at the presence or absence of known disease, signs or symptoms suggestive of the disease, medical contraindications, at-risk individuals who should first undergo medical eval, and those with medical conditions who should participate in medically supervised programs as well. Sometimes they're going to be too sick to work with you at a gym, right? So here's the Part Q. Any of you that have ever worked at a gym have filled one of these out, or had people fill them out. It's a minimal health risk appraisal, prereq, quick, easy, non-invasive, limited by its lack of detail, may overlook important health conditions, medications, past injuries. Again, this one's basically the one you do to go work out at the gym. That's why it's a quick skip over, because it doesn't matter what they answer on it. In all honesty, at the end, it says you do understand if, things can happen in the gym, blah, 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 and you're going on your own to do this, right? Right. And they sign it, right? Because the gym's just providing them a space to do things and equipment to do things. They're not making them do it. Where it's a little bit different with you as a trainer, because you are supervising them to do things. Okay. So again, here's risk stratification. Just kind of gives you the low, moderate, and high risk. Again, we're not really worried about that, because we are not going to determine low, medium, and high. In all honesty, we're going to get back from the doctor what we can and cannot do. Okay. They're going to fill out the questionnaires that you give them, and if they basically, like, even if you suspect like they might have some risk stuff, if they're like, no, 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 I'm fine, I mean, again, that's the thing. Now, if you start to notice things, that doesn't excuse you. So if you notice certain things with them, like that, like that are concerning, then yes, you have to stop the exercise. At that point, you have to say, look, I really think you need to go see somebody, and if you don't feel comfortable training them, then don't train them, right? If they're not going to be honest with you. Okay. So risk factors, age. Yeah, you get old, it's a risk factor. And we will all get to these ages at some point. Family history, right? Of things. And again, you never know what your genetic tie is, right? Some of you have really strong genetic ties to the same diseases your parents have or grandparents have. Some of you don't, but you don't know how strong it is until you get there. Past cigarette smoking, sedentary lifestyle, being obese, hypertension, dyslipidemia, right? So this is where you got high LDL and low HDL. Pre-diabetic, or you could have, uh, diabetes. All these things are risk factors for an episode while you're working out, or risk factors that, and again, why are they coming to see you? Because some of them, some of them are trying to combat all these things, right? So again, they need to come work out, but again, working out, depending on how bad some things are, can also put them at risk, right? We won't go through this on the recording. We'll go through this in person so that we can kind of talk through it. Eval forms, again, they're gonna, yeah, I mean, I would just use your general ones that you can get from the ACSM, that basically say, like, as far as I know, I'm healthy, and I release, the personal trainer for liability. As long as, and again, they release you from liability for injury and things like that, as long as you're doing what you're supposed to be doing. Now, if they can prove that you weren't doing what you're supposed to be doing, that's a whole different deal, right? So again, here's the health history questionnaire, that you'll give them. And again, it's a little bit more than the Part Q, but it doesn't take real long to do. And it helps to really like tease out some things that the Part Q misses, that you would like, if they do answer yes to anything, you'd like their doctor to sign off on before they do something. Okay. Attitude questionnaire. I honestly think this is worthless, to be honest. This gives you an idea of, like, I mean, this will give you an idea of their past. You can also ask them questions, but I mean, to really get their, I mean, I I I I would use this for research purposes only. I mean, because it gives you an idea of like where people are in our society on like kind of their attitudes towards exercise. But I feel it's a cold way to find out like really what they feel about it. Where if you just have a good conversation with them, you'll get I think you get a better real sense of that. Because again, a lot of these things people don't really know, especially when you have the 1 to 5 scale. They're like, well, am I a 3 or am I a 4? Am I 3 or am I 4? Or am I 4 or am I 5? 4? I mean, it doesn't really tell you where they are, where they could actually probably clarify it better if you kind of ask them, like, um, what's your, like, were you a good athlete? I mean, why were you good? Like, what sports did you play? I mean, kind of how good were you? Like, if you want to ask all that stuff that they have, so I mean, is that playing into like why you're wanting to work out now? I mean, what got you out of being physically active all these years and things like, I mean, you can ask those questions, and again, you can get better answers when you ask those questions rather than here's a piece of paper, fill this out. Okay. um you know yeah, the medical release, again, you'll have to get a medical release if they answer yes to any of the stuff on the health history. And again, whatever the physician says to do or not do, you got to do that. It is what it is, right? Again, recording tests and measurement stuff, you may have testing forms for that. Just again, that's up to you, up to the client if they want to be put through tests or if they just want to start working towards things too. So injuries can come from aggravating existing injuries or creating a new one, right? And again, you as a trainer should not help them to create a new one. And again, if they have an existing injury, you need to be aware of that, so that you can try not to aggravate it and constantly ask them, like, how does that feel on your hip, or how does that feel on your ankle, right? Any weird popping or feel, just constantly talk to them about it. Your cardiorespiratory, musculoskeletal systems will all feel stress during physical activity. And that's why if any of those systems are compromised, it can get a little scary. And that's why your doctor's got to sign off on things, right? So here's some things to understand. So atherosclerosis is accumulation of fatty cholesterol, calcium deposits on your artery walls, causing hardening, thickening, and loss of elasticity. And again, it cuts off blood supply, if they get completely blocked, right? And we call this coronary artery disease, or you'll see it in a CAD. Myocardial infarction is a heart attack. It's the medical term for a heart attack, right? So can be a result of atherosclerosis. So the blood supply gets cut off to an area, to the heart, and that area then goes into myocardial infarction. Angina is just chest pain. That's all it is. And sometimes it's just there, like you could have a panic attack and have it, or it's something serious, right? So again, you can have tightness in the chest, arm, shoulder, jaw. That's, so when you have all those symptoms, that's usually not a good thing. That's usually heart attack symptoms. Again, shortness of breath, sweating, nausea, palpitations. They're basically giving you, like, if you had a feeling of a heart attack. But again, sometimes people just feel chest tightness or chest pain, which is also termed as angina. CAD is, again, history of that or chest pain. You should get a doctor's release. Again, some people that have CAD have never had any symptoms. Hypertension prevalent among elderly and African American individuals. Again, nobody's really released from hypertension. We see it across all races, but they just have a higher incidence in comparison. Risk of CAD, stroke, kidney disease increase with higher levels of systolic, diastolic blood pressure. And we see all of these increase the more sedentary and more obese people are as well. Respiratory system disorders, you'll hear most of them, they fall under the COPD, but bronchitis, asthma, emphysema are all COPDs. Again, you got to have physician clearance because, again, you're going to rely on respiratory system under stress to be able to do things, right? And then if they have any musculoskeletal issues like sprains, strains, knee issues, shoulder, elbow, IT band, shin splints, spine disorders, bursitis, tendonitis, arthritis, weakness or joint laxity, or they've had surgeries that have not quite healed all the way, or they've got instability or weakness because the muscles atrophied after the surgery. Diabetes. So a client situation exercise program should be discussed with his or her physician before they work with the trainer. Again, the physician's got to approve before they do anything, and especially if they're on insulin. And again, there's a lot of folks that have type 1 diabetes. Well, not a lot, but you over the time, if you train enough, you have folks that have type 1. So again, it's completely hereditary, and they will be on insulin. And most of the time they're pretty well educated on what they have to do and not do, and cues of their body and what's going on with the insulin pumps, and making sure to eat certain foods if they're going to exercise. So I mean, and again, if they're not, you need to have a doctor write it out for you and for them. All right. Thyroid disorders. Hyperthyroid individuals have increased level of thyroid hormones and higher metabolic rates. Again, hypothyroid is the opposite, and they may be on medications that regulate their metabolism. Again, there may be some contraindications with certain medications. And again, physician's approval before they start. Hernia. Again, anybody that has a hernia, either in their ab or groin, yeah, they can't, it's they have to take time off before they work out. Again, Valsalva maneuver can really aggravate it even after it's somewhat healed. And so there's certain exercises or you can't really do things where they're going to need to do Valsalva maneuver that you may have to stay away from. Pregnancy, again, there's you just basically with pregnancy, they have guidelines for women at like each week of what they can and cannot do, and also based on their previous fitness status of what they can and cannot do. So you just gotta go through the guidelines of that. At a certain point they can't do prone exercises and things like that because it causes it's going to cause pressure on the baby and the uterus and things like that can be detrimental. So yeah, I mean, there's just certain guidelines you got to follow with that, but they can work out up to the day that they give birth. Illness or infection can impair client's ability to exercise. If you have anything respiratory and it's hard to breathe, right? Moderate exercise may be appropriate during mild illness. Generally not advisable to start a new exercise program while you're sick, right? So again, personal training is all about behavior change, or again, the true measure of a successful client-trainer relationship. Again, like I said, like getting into all that, they try to make it too like clear cut, and it's not. But again, you want to have a it says the trainer's repertoire of communication skills. Like I said, you are who you are, and that needs to that doesn't need to change. Like if I'm watching you like talk to people, like I should just see you, right? Because you want to be open and honest with folks. Now again, you may joke around with certain people that you train because you realize that they like humor, and so you use that part of your personality. You may be more serious with other folks or more compassionate with other folks, which again can be part of your personality, and it comes out more with them because that's what they appreciate, right? But you don't fake it, whatever you do, okay? Because I've seen, you see people like that, and you don't like people like that, and definitely you don't like people like that when they're in business settings. Like it puts you off, right? In determining client needs and desires, personal trainers can appropriately respond at various stages of the client's readiness to change. And it's important to conduct thorough health risk assessment, utilizing appropriate health risk appraisals and risk stratifications. right, that's it. We'll do the second part tomorrow.